Candida glabrata is an opportunistic fungal pathogen that causes infection in immunocompromised individuals. Unlike other Candida species, that makes it unique is it exhibits a notable resistance to antifungal treatment. This poses a significant challenge in clinical management. So, understanding its pathogenicity or pathogenic mechanism and the resistance profile is crucial for effective diagnostic and therapy. So let's dive into it. So the characteristics of Candida glabrata is what makes it unique from other Candida species. Even though this fungal pathogen can live as a normal flora in our oral cavity and especially in females in genital areas, it lives in a small number or small amount, but when it becomes multiplies from that intended amount that is present in that area, it causes infection. So, Candida glabrata is globally is increasing and is recognized for its ability to cause more serious infection. It could be superficial infection or systemic infection or subcutaneous infection as well. So, particularly in immunocompromised individuals, those individuals that have impaired or that has compromised immunity, and it necessitates the awareness of its antifungal resistance, and this pathogen also is known to form a biofilm, or it has a capability of forming biofilm. So it makes it necessary to know about these characteristics in order to clinically manage this pathogen. So when we see the risk factors for infection, the number one is being immunocompromised. That is, individuals that have impaired or compromised immunity are more prone susceptible to the infection of this pathogen. One is the major thing is HIV patients, because their immunity is impaired, they tend to be susceptible to this pathogen, and patients that are undergoing chemotherapy, like cancer patients, are high risk groups. But not only these groups, any individual that has impaired immunity because of anything could be susceptible for this pathogen. If your defense mechanism is compromised, you become susceptible for this pathogen. So, these things that reduces our defense mechanism makes us susceptible. The other one is antibiotic disruption. Prolonged use of broad spectrum antibiotics that can lead to dysbiosis that disrupts the normal, originally occurring normal flora, or the originally found normal flora. Disrupting that normal flora will allow the Candida glabrata to overgrow, and it thrives and disrupts further the microbial flora in that area, and it also causes serious infection after that, because those normal flora were the one that were protecting us, in a way of competing for nutrients or activating our immunity. But when that normal flora is disrupted, especially in hospitalized patients that receive prolonged broad-spectrum antibiotics, this resistant pathogen will overgrow and cause infection. The other one is invasive procedures. The use of invasive medical equipment is such as catheter, surgical implants, and this increases the Candida glabrata infection. So they provide direct access to our system during those invasive procedures. For example, when a patient undergoes a major surgery, those medical equipment might bring this fungal pathogen and give access to this fungal pathogen to our system. So this pathogen will enter into our bodies through that incision or through that catheter, and then it causes further infection. The other thing is also undergoing a major surgery will make us, in order to make us in order to make us our recovery good, our immunity becomes weakened, I think. But that is my theory, not yet proven. When we see the clinical manifestation, the systemic infection indicator at the first, so when the Candida, any kind of infection, not only Candida, enters to in our system, so it may present with a fever, chill, and sign of sepsis, or indicate a severe condition that necessitates immediate intervention, that to prevent this complication and improve patient outcomes. The other one is risk factor influences the presence of underlying risk factors, such as being immunocompromised, using prolonged antibiotics, and also exacerbate the severity and range of the symptoms. Because we are, for example, patients that undergone a major surgery would take prolonged antibiotics during their stay in a hospital in order not to prevent any kind of infection, bacterial infection, for example. So that prolonged antibiotics will give access to Candida overgrow. Candida will overgrow because that antibiotic will disrupt our microbial flora. Then the Candida will overgrow in that area. Then it will enter in our system and then causes further infection. The other one is localized infection symptoms, like include oral lesion, could be because that fungi is normal flora in our oral cavity. So then when that area the area is disrupted, the microbial flora in our mouth is disrupted, this Candida glabrata will overgrow and then cause infection. The other one is esophageal pain, could be. The other one, vaginal irritation, which can significantly impact the quality of life. When we see the diagnosis, timely diagnosis is important for this pathogen in order to diagnose early and accurate, to give early and accurate diagnosis. It is critical to diagnose. That timely diagnosis is critical, as delay can lead to increased morbidity and mortality. When we see the treatment approach for the Candida, the first line antifungal medication that is used to treat this pathogen is echinocandins, including micafungin, caspofungin, and anidulafungin, are the preferred first-line antifungal agents to treat this pathogen, because they are found to be effective against this resistant strain, and also their mechanism of action mostly disrupts the fungal cell wall synthesis, and makes it crucial in managing this severe and systemic infection. When we see the alternative options, we say echinocandins, and also we can also use azoles like voriconazole and posaconazole serve as alternative when echinocandins are ineffective or less effective. But their use must be guided by susceptibility testing to avoid treatment failure due to resistance. But the recommended one is a combination therapy using this echinocandins and azoles together. So because they will have a synergic effect, the echinocandins will disrupt the cell wall synthesis and then also allow the absorption or the utilization of the azole antifungal medications. So using combined therapy as a good approach for this pathogen. The other one is the treatment of this pathogen should have to be supported and followed by antifungal susceptibility tests, because this antifungal susceptibility test will guide effective treatment choice. Because it is resistant pathogen, it will give us or it will show us which antifungal treatment is sensitive or resistant to this pathogen. So in order to use sensitive antifungal agents for this pathogen, using antifungal susceptibility testing is a good approach. It also shows us the adaptation pattern or to adaptation pattern to the resistance of these antifungal medications. It also reduces the healthcare costs, because once we test the antifungal agent susceptibility, then it will we don't waste our time on resistant antifungal agents. We only use sensitive ones, so it also reduces the healthcare costs. The major issue in treating this resistant fungal pathogen is treating the underlying health issue. Because, for example, since this pathogen is opportunistic pathogens, resisting the underlying health issue will be the most and the major approach. Because when the patient's or that person's immunity becomes competent, it will also help the treatment to overcome that pathogen. So the other one is self-care strategies while awaiting the treatment. One is hygiene maintenance. This one are the preventive mechanisms. One is the hygiene maintenance. We have to maintain our hygiene from further infection. The other one is balanced nutrition. In order to boost our immunity and to make ourselves immunocompetent, we have to take a balanced nutrition. The other one is mental health focus. For example, if we are stressed, our body becomes weakened. The treatment that we took, for example, the treatment that we took as antifungal agent only help us around 70%. The other 30% is gonna be our mental status. If we are stressed, the treatment might not work as well. So we have to focus on our mental health as well in order to have a good care and treatment. Uh, we have to seek urgent medical attention when we see and recognize severe symptoms, and when we identify a localized infection as well, and when we see and or monitor any kind of chronic condition, we have to seek urgent medical attention, because not seeking urgent medical attention could lead to further complication. Thank you. Subscribe and like my channel if you like the content that I am preparing. It will help me to keep focus and prepare another content. Thank you.